All right. Well, thank you very much for being here. Yeah, it's great to be here on such a nice day. Pennsylvania continues to make good progress with its rollout. Let me just give you a few statistics. As of this morning, Pennsylvania was at a point where we had 31% of our population had gotten the first dose. The national average is 29%. I think we were, that made us 13th in the country among the states. The second doses, the United States average is 16% of Americans have gotten their second dose. Pennsylvania, we're at that national average, 16%. If you look at the 10 most populous states, we're number one in the country in terms of first doses, and we're tied for second with a bunch of the big states for number two. We're at 16%. Michigan is the top of the big states, and they're at 17%. On the Becker survey, which is the percentage of doses administered, we're at 82%, which makes us 21st in the country. So we're making some really good progress in getting the vaccine out. And what you see behind us here is an example of the great work that people are doing all across the Commonwealth to make sure that we get these shots in people's arms as quickly as possible. We estimate that we're more than 3/4 of the way through just our 1A population, and we should be finished with them fairly quickly. We're nearing completion of our special initiative to vaccine teachers and school staff. We started that a few weeks ago. The goal was to get every teacher from child care folks all the way up to high school teachers vaccinated, and that's teachers in public and private schools, teachers, cafeteria workers, janitors, administrative staff, bus drivers, everybody, to get our kids back to school. The idea was that by the middle of April we would have gotten everybody the vaccines in all those folks' arms. Turns out we're 2 weeks ahead of schedule. Should be finished today or tomorrow on that. So we're moving forward, and the organizations, folks who are providing the vaccines are actually finding it that they now have room to make the appointments, that the waiting lists are actually coming down. So we're making some good progress, and it's places like this that really make the difference. We anticipate receiving a steady cadence of allocations of all COVID-19 vaccines from the federal government, and I got to say the feds have done a nice job of keeping a good supply, not only steady but increasing dramatically every week, and we're hopeful that that's going to continue in the coming weeks. And given the comments that the president has been making, that actually is something that we're pretty sure is going to happen. As the supply grows, Pennsylvania will continue to enact a multi-pronged approach to distributing vaccine throughout the Commonwealth. Again, our goal is to administer vaccine as quickly, as fairly, and ethically as we possibly can. We know that different populations face unique challenges when it comes to assessing getting access to the vaccine, and we're going to strive to finish vaccinating our phase 1 population again within the next few days. Again, the idea was to have everybody in 1A have at least one shot, and if not the one shot, an appointment within a reasonable period of time, like a week or two, by tomorrow, and I think we're on schedule to do that. We need to use a variety of approaches to ensure that all Pennsylvanians can get the vaccine, and that means we have to work with local providers like the federally qualified health center I visited last week up in Scranton. They can do intensive outreach to vulnerable populations in communities where we really need to take affirmative steps to make sure that we're reaching everybody. But it also means working with mass vaccination sites like this that have the resources and the tools and the personnel to vaccinate a large number of Pennsylvanians very quickly. And that's exactly what the Dauphin County mass vaccination site has done here at the Harrisburg Area Community College, I think that's the name of it. And the vaccination clinic is set up as an easily accessible location. And just talking to some of the folks here, I think they really like the fact that it is convenient. This clinic has the benefit of being a drive-thru site, so you can make your appointment here, you can drive up, you can check in, get your shot, wait out way over there for 15 minutes. You can do all that in the car. And that's for Pennsylvanians who can drive themselves. If you can't drive, capital area transit buses are available to shuttle people in and out of this place. So I think they're covering as many bases as they possibly can, and I want to thank the dedicated staff, some of whom I've met here, with the folks who are working here, and I want to thank everybody who had a hand in getting this site up and running, which really goes back to the late summer of 2020 when they started planning for this. Their efforts to protect our fellow Pennsylvanians are saving lives, and they're making communities like this safer. Large capacity sites like this one at HAC, just another great tool in our toolbox as we work hard to make sure that every Pennsylvanian, no matter who they are, where they're from, get vaccinated as quickly as possible. Obviously, as more vaccines become available, as the supply starts to meet the demand, and that's coming, then we're going to do a better job here. But in the meantime, we will do everything we can to make sure everybody in Pennsylvania gets the vaccine as quickly and as fairly as we possibly can. That's our goal. So now I'm really pleased to turn this over to UPMC's CEO, Bill Guarneschelli. Guarneschelli.
Thank you, Governor Wolf. On behalf of UPMC and the hundreds of employees working at clinics throughout central Pennsylvania and the Commonwealth, we truly appreciate your support of our vaccine efforts. Thank you, Commissioner Pries, Commissioner Hartwick, thank you, and Harrisburg Area Community College, yay, thank you, for the partnership that has enabled us to have the first UPMC drive-thru COVID-19 vaccination clinic in Dauphin County. UPMC is proud to play a leading role in distributing and administering COVID-19 vaccines efficiently, equitably, and safely. Our goal is really simple. We aim to meet people where they are and to vaccinate as many individuals as we possibly can with our available supply. This past weekend, UPMC hit a milestone, providing our 300,000th dose of COVID-19 vaccine. More than 177,000 of these went to people not affiliated with UPMC, including our first responders and community members. Locally, we have given almost 50,000 doses of this life-saving, precious vaccine. Week one for this drive-thru clinic behind me went very smoothly, and the first 2 days we delivered and vaccinated 1,500 people. Our teams are working very effectively and efficiently, and they look forward to giving 3,000 more vaccines this week. I am very pleased to share with you that this drive-in clinic, starting April 19th, will be open 4 days a week. A drive-thru clinic allows us to safely increase the number of people we can vaccinate through one clinic. It is also helpful for those with mobility issues, and it supports physical distancing. It is important to recognize that drive-thru clinics serve some patients really well, but not all, particularly those with lack of transportation. For those individuals, UPMC has a multi-pronged approach to vaccinate includes local community-based clinics as well as the drive-thru options you see here, so that we are reaching all who want to receive the vaccine. That's why this past week we also started our at-home bound patient program, vaccinating them at their homes. Before I introduce Commissioner Pries, I feel it's important to remind the community that all vaccines are by appointment only. Invitations for any UPMC clinic are drawn from those eligible individuals who have registered through UPMC's online registration system or our call-in number. Eligible members of the community are encouraged to register at vaccine.upmc.com to be contacted for future vaccination events. There is a phone option, as I mentioned, as well for those who do not have computer access. UPMC is actively contacting registrants to schedule appointments as quickly as they become available. The response to this drive-thru clinic has been tremendous, and we applaud the public's enthusiasm to receive the COVID-19 vaccine. It has and it will continue to save lives. It is now my pleasure to introduce Dauphin County Commissioner Mike Pries. Mike?
Nice job. Good afternoon, everyone. It is an honor and a privilege to be standing before you today. I want to thank you, Mr. Guarneschelli. I first of all want to say a thank you to the media, our print media, our radio media, and our television media for the incredible job that you've been doing letting the population know about what's taking place here. You're doing a fantastic job, and we can't thank you enough for the great message that you're putting out there for the residents of Dauphin County and central Pennsylvania. A thank you to UPMC for stepping up to the plate. We've been planning this since September of 2020, our Department of Public Safety and the emergency planners. But until we had doses ready to allocate, we were not ready to open up this site. A week and a half ago, UPMC stepped up to the plate and made that commitment so that the residents of Dauphin County and central Pennsylvania can come here and get these doses. So thank you very much, UPMC, for not only providing the expertise and the vaccines, but also the staff and the volunteers to help this site run. A thank you to Harrisburg Area Community College and Dr. Sagansky. Wonderful job by you and your administration. What you see here, this is the site. This is a centrally located site, smack dab in the middle of Dauphin County. Easy ingress and egress to the site, and access to Route 81, 322, Route 83, the northern end of the county, the southern end of the county, local municipalities like Susquehanna Township, Lower Paxton Township, the borough of Steelton, and the city of Harrisburg, home of our state capital. I also want to say a thank you to the Department of Public Safety, again, for the great work that they and their staff did for several months, getting this ready to go, dotting their I's and crossing their T's. And last but not least, Governor Tom Wolf, thank you for taking the time from your busy schedule and coming here today and learning about this drive-thru vaccination clinic that's helping so many. We're rooting for you, sir, to get us more doses so that we can provide more doses to the residents of Dauphin County and throughout the Commonwealth of Pennsylvania. Light is truly at the end of the tunnel. Without further ado, at this time, I'd like to turn it over to my colleague, who is such a great servant on behalf of the residents of Dauphin County. He puts others before self 24/7, 365. The work he does for the human services in Dauphin County is second to none. Ladies and gentlemen, George P. Hartwick III.
Thank you, Commissioner Pries, Phil Guarneschelli, Governor Wolf, Hack, the biggest cheerleader I know for my favorite community college. Some of the comments today, as you walk around, Public Safety Director saying he's never had a large, comprehensive effort that is going on with multi-level agencies that has had this level of communication and cooperation. The idea that when we go to the tent, the folks were saying, we don't know if somebody's a hack employee, UPMC, whether they're public safety. You know, it's sort of like emergencies and pandemics bring out the best in people, the ability for us to come together and to be able to serve a higher purpose. And that spirit is extraordinarily evident here in the ability to provide services. We have been coordinating for some time with UPMC. I know even as recently as this week, I know we were providing a list of homebound individuals that they've already provided vaccinations for. And we know that that project and process will continue. This has truly been a partnership, one that early on we still know there's a great deal of frustration with trying to provide access and information. So much so I was contacted by Bob B. of 27 News and being able to take some of the frustration from folks who are attempting to get vaccinations and trying to make sure it's clear that they can either access it directly through UPMC, but if there are challenges, Dauphin County and Area Agency on Aging is also a safe place to be able to communicate and allow us to put you on a list to ensure that you are vaccinated. This isn't about taking credit. This isn't about pointing fingers. This is about working together to defeat a common enemy and to ensure that we can get back to at least some level of normalcy as the sun shines today, as the ability to get shots in arms continue. I think we should remain optimistic that both your leaders at the state, local, and from the hospital and nonprofit level have come together to be able to serve the needs of our residents in Dauphin County, and the capacity is just beginning to be seen here. We talked about the doses that have been given this week. I think they have the capacity to do significantly more, and when Johnson & Johnson comes online, I think we are poised and positioned to be able to make sure that all of those doses get into arms. And I think it's also important to note, in talking to the pharmacy and to the UPMC folks, that no doses are going wasted, that all doses are being utilized, that are being provided, and the scheduling and the ability to coordinate that effort is no small task. So let's give a round of applause and credits to the healthcare heroes and everybody that's working to address this pandemic. Thank you for the opportunity to address you today, and it's my honor to turn the microphone back over to our Governor, Tom Wolf. Governor?
So now I'd be happy to take questions. Yes.
Governor, thanks for your time again.
Go ahead.
New York is launching an app for vaccine passport, but the governor in Florida, Governor DeSantis, says he's against vaccine passports. Where do you stand on vaccine passports, and could you see that in Pennsylvania?
I don't really have a position on passports. You know, you used to have one when you travel overseas. It was part of your passport. It was a yellow card that showed what immunizations you got. So I'm not sure. You know, I would think that would be a fairly easy thing to do. Excuse me?
Do you support that?
Yeah.
Proof of vaccination.
Yeah, if that were something that seemed to come from the General Assembly, yeah, I'd support that. Yes.
Is Pennsylvania on track to be able to open it to everyone, as Joe Biden has said, by May 1st?
Yeah, that's a good question, because I think most of the states have actually established a time, I think in every case, before the May 1st deadline that the president established to do that. So I would hope that very quickly. I mean, we're talking about that now as to how we want to move through beyond where we are right now, and how quickly we can do it. We have a better sense of what the supply is, what vaccines are coming, what the demand is. So I'd like to get, as I said, the goal is to get the vaccines to as many people as quickly and fairly as possible. That's always been the goal, and it remains the goal. So the sooner we can get to that point where everybody's eligible, the happier I will be. Yes.
I spoke to a local resident this morning who detailed to me about how he's registered with all the providers around here, including UPMC, and he's been going to these sites daily, and he said that he has yet to be offered an appointment, or he is yet to be scheduled, and that seems to go against the order of mid-March. I mean, what are your thoughts on that?
I don't know that case. I mean, you talked to him, so maybe there's something I'm missing. I asked that question here, and I think the experience is that people who want an appointment can get one now. And there are places actually in the state where there are slots open. So I just don't know that particular case. That's not what I'm hearing.
Can anybody here address that? Whether everybody that contacted UPMC seeking an appointment has been offered one or scheduled as per the governor's order?
Well,
Phil will answer that, and
Phil,
I'll
you want to
also-
take that?
I can say this, that we make every attempt to vaccinate folks that have entered the site or have called in. I don't know this particular situation, whether they're 1A with medical issues, but we will certainly look into that and get them done. I mean, our goal is not to leave anybody out. I can tell you that. Our goal, as the governor has said many times, is to get everybody effectively, efficiently, safely, and equitably vaccinated.
And as we've been trying to do with seniors and other residents, if there are concerns, they need some support from a technology perspective, they need to be placed on a list and some assistance to put on the site, make sure they contact Dauphin County's Area Agency on Aging. We are running active lists and communicating with UPMC. So if there's any reason they've been missed, we want to ensure that we do what's necessary to manually place them in and to ensure that they're a part of an upcoming vaccination clinic.
New York is already up on the vaccination eligibility to basically every adult, and I think Ohio has done the same. What makes Pennsylvania different that you're holding back and not doing that?
No, we're not. We haven't decided what we're going to do yet, but that's coming. And as you point out, it's not just a few states. It's most of the states in the country have done that, and every state in the country is expected to do that according to the president's requirement by May 1st. So I think we're talking about it right now.
Governor, I wanted to piggyback that, but be a little more specific. In terms of the federal rollout, I understand that the supply comes from the feds. But when we talk about Pennsylvania, if the model is to go off a percentage of the state's population, how much you get, one of the concerns that I have is that we have a lot of seniors in Pennsylvania. So I feel like because we haven't gotten a supply that is equal to maybe the number of seniors or vulnerable peoples that we have, that's why we're behind the other states. Do you think it's on the feds to get us more of that supply so that we can get through 1A? Because we're watching all these other states move to other phases and get 20 and 30-year-olds who are perfectly healthy their vaccine.
Okay, well, two things. First of all, I'm not sure why you say we're behind other states. We're number one of the biggest states in the country in terms of first doses, and we're second in terms of second doses of the biggest states.
I mean, in terms of phases, getting through phase 1A, we're behind.
I'm not sure. We're almost finished with the teachers. We'll be tomorrow. I'm not sure what phase you're putting them in. Anyway, I think you make a really good point in terms of the allocation right from the start. Back in the Trump administration, the allocation was done according to population, and it made the assumption that every state had the same demographic structure. Well, as you know, as you just pointed out, that's not true. Pennsylvania is one of the more senior states, and so especially when you put you make such a big proportion of your 1A population, your priority population, folks 65 and older. Well, Pennsylvania has a big chunk of those. So on that metric, you might think that the fairness thing would have been to say, okay, we're creating this, we're asking you to do 1A and give that priority. We will actually allocate the vaccines according to that. They didn't. So I think that led to Pennsylvania maybe getting off to a little slower start, but I think thanks to folks like UPMC and Dauphin County, we've actually done a good job catching up, and even though we're not quite through 1A, we should be in the next day or so. We have, I think, done a really good job catching up. At one point, we were actually first in the country in terms of the speed with which we were improving our allocation. So I think that's the key that we want to look at. Given whatever the situation, I think there would be all kinds of opportunities to say there might be some unfairness here. Given whatever the situation is, how good a job is Pennsylvania doing? And I think we're doing a good job.
Governor?
Yeah. Oh.
So tomorrow the House State Government Committee is going to have a hearing on procurement and storage of PPE. And right across the street at the farm show, we have about $51 million of reserves. People are curious about the plan, and are you comfortable that there were people that needed it, that we were getting it to them, or what is the goal with that PPE sitting there?
Yeah, I'm comfortable that we are getting it to the people and institutions that need it. But we weren't doing that in the very beginning. I don't think any state was. The country wasn't doing it. We didn't have it. And people were scrambling, states were scrambling, the healthcare systems were scrambling. I know, Phil, you guys were scrambling, I'm sure, too. We were all trying to find a limited supply, and we were probably, unfortunately, competing with each other on price and probably driving the price up. So the goal here is to make sure that doesn't happen again. And you got to make sure that you don't have this protective equipment that's getting stale or old. But I think it's something that we've learned during this pandemic that maybe governments ought to make sure that we do stockpile something. So I think the committee is doing the right thing and saying, what's the right way to do this? The administration's we've recognized that we can't keep it at the farm show forever. So we're looking to rent new space, and if there are other ideas out there, I'm very happy to take those good ideas. I think we're all on the same pages in terms of saying if we ever go through anything like this again, let's not be as unprepared as we were when this started. Yes.
Governor,
question with respect. It sounds like that you're satisfied that you feel that we're positioned well with respect to vaccinations. I think UPMC talked about homebound vaccinations. Are there still things that we can do to expand our capability or ability to provide vaccinations beyond these massive, drive-through clinics? What else can we possibly do or enhance that's already in place or add to?
Yeah, I think there are a lot of things that we need to think about as supply continues to increase. We've got to think about the populations that might be harder to reach, folks who might be reluctant to get the vaccine, people who might not have the capacity to drive to a place like this, shut-ins, people who just might be reluctant to get a vaccine. So we need to do a number of different things. I think there are three broad channels that we have been looking at right from the start. I'm sure we'll find other ways to do this, but the first is through the pharmacies and healthcare systems, the network of medical professionals and pharmacies that people can go to that are in their neighborhoods. We have hundreds of them around the state, and that's not a one-size-fits-all, but it gets to a lot of people, and they have good logistics experience. The second would be mass vaccination sites like this. Third would be more mobile settings that really are taking affirmative steps to say, okay, we need to get to this particular population here, and we know if we just set something up here or in a pharmacy, they're not going to come out. How do we get to them? So that's probably a more mobile setting that's going to require some outreach.
You talked about supply and demand. Are you optimistic or confident that will be there as we continue to move forward?
Yeah, I mean, everything I've seen, the rate of growth has been tremendous. I actually do a spreadsheet, and I update it every week to say where are we going to be in terms of the state allocation by the end of April, by early May. And my back of the envelope Excel spreadsheet calculation is that, by the end of April, early May, we should be at a point where we should have enough vaccines that have come through the system to satisfy everybody who at least wants the first vaccine. Obviously, some of these, Johnson & Johnson is a one-dose vaccine. Moderna and Pfizer are two, so that won't be that everybody gets it. But, the Biden administration, I think, started out with the idea that everybody would be eligible by May 1st, and I think he did that with some confidence that there would be, the beginnings of enough to actually satisfy the demand that's out there. I think sooner or later we're going to get to a point, probably sooner rather than later, where we're actually dealing with problems where the supply is greater than the demand. We're not there yet, but I think we're moving toward that fairly quickly.
Thanks, everybody.
Thanks, everybody. Thanks.